is the outline of my talk for today. First, I will begin with patient preparation. This is the first step to create the optimized image. Second, I will discuss about the ultrasound equipment and how to adjust the image to optimize image quality, which directly affect the interpretation. Lastly, I will talk about how to perform an ultrasound scan of organ system in accordance with the new guideline in the ACVR and ECVDI consensus statement. Preparation for ultrasound examination is the first important step for performing an abdominal ultrasound. It can help you create optimized image to increase the accuracy of the diagnosis. The thing you should know before ultrasound is the patient signalement and history. Patient signalement and history are essential factors to consider before performing an ultrasound. Patient signalement include age, breed, sex, and weight, which provide important context for the examination. Certain age group or breed may be predisposed to some specific condition. For example, in young patients may be more susceptible to congenital disease, while older patients may be a risk for the age-related condition or neoplasia. The patient history and indication for ultrasound can guide the focus of the examination. Symptom duration of the issue and previous treatment can help identify the specific area of concern, improving the efficiency and accuracy of the examination. Finally, a list of differential diagnosis can help direct attention to specific conditions based on the reason for the ultrasound examination. Patient preparation is also important for ultrasound examination. This can help to create optimal image as well as reduce the incidence of artifacts. First, patients should be fast for at least 8 hours to minimize interference from gastric content, particularly when imaging the gastrointestinal tract and cranial abdomen. The hair coat must be clipped and the skin should be prepared with alcohol and or acoustic gel. Most patients can be manually resistant for ultrasound examination. However, anxious, non-compliant, or aggressive patients may not tolerate the examination. Sedation can help to examine this patient as well as perform tissue sampling procedure. However, it can affect the organ size appearance, so the administration and type of sedation should be noted in the patient history. Ultrasound equipment is crucial for ultrasound examination because it creates the image necessary for diagnosis. While a high-performance machine can create high-quality image, image adjustment also affect image quality such as the focal zone, depth, gain, time gain compensation, and frequency of the transducer. Additionally, some ultrasonographic functions such as color and power Doppler ultrasound imaging can be used to evaluate the vessel and blood flow. In the following slide, I will discuss the effect of image adjustment on image quality and how to adjust optimal image. The focal zone appears as the red triangle, and it should be adjusted to the area of the interest to improve the lateral resolution and reduce artifact. In this picture, you will see the different level of the focal zone that affect the image resolution. In the left picture, the focal zone is adjusted to the level of the urinary bladder wall, resulting in a clearly visible bladder wall layer. In contrast, in the right picture, the focal zone is adjusted to the deeper area, resulting in an unclear visible or bladder wall layer. So please adjust the focal zone in the area that you interest. For gain determine the level of amplification of echo to compensate of the attenuation in the tissue. Increase the gain, increase the overall brightness of the skin. In the left picture, the image is too dark and the lesion cannot be clearly seen. By increasing the gain, the overall image becomes brighter, resulting in a clearly visible nodule in a spleen. According to ultrasound waves are lost their signal as they penetrate deeper area. So ultrasound machine can adjust the amplification of the echo using a slide button called time gain compensation control or TGC. TGC is different from overall gain adjustment, while gain adjusts the image display overall. TGC adjusts the amplification of the echo at each level. Amplification should normally be reduced in the superficial area and increased in the deeper area. In the left picture, show increased superficial amplification when the button is slid to the right, resulting in a brighter display of the superficial region here. On the other hand, the deeper region appears darker due to the TGC being setting to the left. In the image on the right, TGC is set on the left in the superficial region and to the right in the deeper region, resulting in the brighter display of the deeper region. This correlates with the nature of the ultrasound wave, which lost strength as they penetrate to the deeper area. So we need to amplify the echo signal. Getting that was a urinary bladder mass. When performing abdominal ultrasound in dog and cat, the transducer should have a frequency range between 5 and 18 MHz. The linear produced transducer is the best suited for imaging superficial structure and small dog and cat due to its high frequency, which provide high resolution image. However, high frequency ultrasound wave cannot penetrate to the deeper area. Therefore, curved linear probe, which has a lower frequency, is more suitable for imaging the deeper tissue or large animal, while phase array probes are typically used for cardiac examination. The key point in choosing a transducer is to use the highest frequency that provide adequate tissue penetration for optimal image resolution. Once you have obtained the image, the next question to ask is whether the organ appears normal or abnormal. You can describe the image by using the term lemons. Lemons stand for L for location, which evaluates whether the organ is its normal location or not. E for ecotexture and ecogenicity, which determine whether the organ is homogeneous or heterogeneous and their ecogenicity. M for measurement, which involves comparing the site with a reference. O for outline, which evaluates the margin and determine whether it has a smooth or irregular margin. N for number, which determines the normal number of each organ. And S for shape, which evaluates whether the shape is normal or not. Now we will move to the scanning organ system. In this topic, I will explain how to locate an organ and how to scan it in accordance with the new guideline for standardization of abdominal ultrasound. Additionally, I will provide information on how to identify whether the organ is normal or abnormal. A checklist of organs provides a systemic approach that guarantees consistent following of all necessary steps during an examination. This standardization minimizes the risk of missing a lesion and helps maintain uniformity in your ultrasound examination. You can start with any organ you want, but make sure to check that you have complete the following list: hepatobiliary system, spleen, gastrointestinal tract, pancreas, urinary tract, adrenal gland, genital tract, lymph nodes, mesentery and omentum great vessels, and peritoneal and retroperitoneal space. Okay, we will start with the liver. The liver is a large organ that easily to find and locate at the cranial abdomen. Longitudinal and transverse vein should be obtained. In the deep chest dog, the intercostal approach can perform to assess the liver in the rib cage. Compare the echogenicity of the liver with a spleen or falciform fat in cat. You can use the split skin image to compare them. Please note, do not change any parameters such as gain, depth, or TGC because they affect the image appearance. Any parenchymal region should be documented by location and size, measurement in true plane. If there are numerous lesions, only the largest lesion needs to be measured and documented. Investigate the hepatic lymph node if possible. In suspected portal situation or other portal vascular abnormality, the portal vein to aorta ratio should be performed near the hilus of the liver. For the biliary system, the gallbladder is located in the right cranial abdomen of the wall should be evaluated as well as the appearance of the gallbladder contents. When visible, the intrahepatic biliary duct, cystic duct, and common bile ducts should be evaluated, and the wall thickness and intraluminal diameter should be measured. The next question is, what is a normal liver? It is difficult to determine the actual size due to the variety of the size between different species, breeds, and conformation. Normally, the liver has a sharp margin. Enlargement of the liver can be identified by the blunting of the edge. The normal liver is homogeneous echo texture and mildly hyperechoic or isoechoic compared to the normal renal cortex, but it should be hypoechoic to the splenic parenchyma. This video shows an image of a normal liver. You will see it has a sharp margin and homogeneous echo texture. It is the stomach. This picture shows the comparison of echogenicity between liver and spleen by using the split image. Liver should be hypoechoic related to spleen. It means liver should be darker than spleen. Please note that do not change any parameter when use the split image to compare the organ. And what is a normal biliary system? For gallbladder, the gallbladder normally appears as a pear-shaped structure. However, in some cases, the gallbladder may have a fold or bilobe appearance, dogs, and 1 millimeter in cats. The common bile duct opens directly into the duodenum at the major duodenal papilla and is separate from the main pancreatic duct in dog. However, in cats, the pancreatic duct and common bile duct are fused prior to entering to the duodenum. If visible, the common bile duct should be measured. The upper limit of normal inner diameter should less than 3 mm in dog and 4 mm in cats. This video shows a normal gallbladder. The gallbladder is appear like a pear shape and has a thin, smooth wall and bile apparent and echoic. This is the liver and this is a stomach. The next organ is the spleen. The spleen is elongate and tongue-shaped. Is located between the gastric fundus here and left kidney here and appear as a hook shape. When scanning the spleen, it should be viewed in both longitudinal and transverse plane. In cats, splenic thickness should be measured at the level of the hilus in the longitudinal plane. Similar to the liver, any focal lesion should be measured. If multiple focal lesions are present, measure the large-scale lesion. What is a normal spleen? The splenic parenchyma has a homogeneous and fine echo texture, and it is covered by thin hyperechoic capsula here. Additionally, the spleen appears hyperechoic compared to the liver. In dogs, splenic size is often evaluated subjectively, identified by a blunt margin, indentation to the urinary bladder, and presence of the spleen on the butt side of the abdomen. In contrast, in cat, the spleen is more consistent size. That should be less than 1 cm in thickness. This picture shows the splenic head, which is located between the left kidney and the gastric fundus. It appears as a hook shape. This slide shows the splenic hilus here in the arrow, which is the region used for measuring the splenic thickness in cat. In cat, the splenic thickness should be less than 1 cm. Ultrasound examination of the gastrointestinal tract should include the stomach, gastric fundus, body and pyloric antrum, duodenum, jejunum, ileum, ileocephalic junction, and colon. Each segment should be examined in both the longitudinal and transverse plane. In addition, for each segment, evaluate the wall layering, thickness, and echogenicity of the mucosa and luminal content. What is the normal gastrointestinal tract? This slide shows the normal ultrasound appearance of the intestine, consisting of 5 layers from inner to the outer as follows. The inner mucosa to luminal interface appear as the hyperechoic line or bite line. Next is the mucosa. Mucosa appear as a hypoechoic layer or dark layer. Is the normal 5-layer appearance of the intestine. The table shows the normal reference length of gastrointestinal wall thickness, which depends on the segment, species, and body. For feline, the stomach should be less than 4 mm in thickness, and the small intestine such as duodenum, jejunum, and ileum should be less than 3 mm. The colonic wall in cat and dog is the same, should be less than 1.5. In the canine, the stomach should be less than 5 mm. And the duodenum, jejunum, and ileum, it should be approximately 5 mm. This picture shows the stomach. It is located near the midline, close to the xiphoid process to evaluate the gastric body and fundus. Sweep the probe to the left side, and then sweep the probe to the right side to evaluate the pylorus. In this picture, show the emptying of the stomach. Please note that the gastric wall thickness should be measured at the interlocular fold in the transverse plane. This is the reason why the patient should be fast before performing an ultrasound. In this picture, you will see the stomach is markedly distended, and there is a lot of foods produce the acoustic shadowing artifact that can obscure any lesion below it. In patients with vomiting or suspecting foreign body, the pylorus should be investigated due to the most of gastric foreign body may obstruct in this region. To locate the pylorus, Follow the stomach and sweep the probe to the right in the dog or to the midline in cat. You will see this is the stomach and this is the duodenum. The pilus is the connection area between the stomach and duodenum. If there any foreign body here, you can see it. You will see this is the stomach and there is the gastric content here and it is the duodenum. So this area is the pilus. The duodenum can be located more easily by placing the probe longitudinally along the right ventrolateral abdominal wall near the right kidney. In dog, the duodenum is the thickest segment of the small intestine, while in cat, it has a thickness similar to that of the jejunum. Generally, the ileum and jejunum are difficult to trace and assess in isolation due to their overlapping. Slowly sweep the probe while scanning the cranial, left, caudal, and right part of the abdomen to ensure that no abnormality are detected. The ileocephalic junction should be identified in cat. This structure can be detected in the right middle abdomen. You find the right kidney first and sweep the probe into the medium. You will see the ileum here and the descending colon. Or you can follow the colon from the descending colon, transverse colon, and ascending colon, and you see the connection between ascending colon and the ileum. In dog, it's more difficult to define it because there is a lot of gas in the cecum. The large intestine or colon can be easily identified by located the urinary bladder first. The colon is located dorsal to the bladder. The descending colon is located on the left side of the abdomen, while the transverse colon is located caudal to the stomach. The ascending colon can be detected in the right abdomen. If you can follow the ascending colon, you can find the cecum. The normal colon has a thin and layerless wall and often contains gas and feces. Now we move to the pancreas. The pancreas is thin and elongated organ located along the greater curvature of the stomach. This is the stomach, and here this is the spleen that I draw. This is the pancreas here, and stomach around here. This is the duodenum. Okay, it located along the greater curvature of the stomach and the mesenteric border of the descending duodenum. Normally, the left limb of the pancreas is easily to seen in cat, whereas the right limb is easily to seen in dogs. The left limb of pancreas is located between the stomach. Left limb is located between the stomach and transverse colon and spinoportal vein. The right limb here is located between the descending duodenum and the right kidney. To investigate the pancreas, or pancreatic lobe should be investigated in both longitudinal and transverse plane. If visible pancreatic duct, the diameter should be measured. Evaluate the peripancreatic fat if it's normal or abnormal. What is a normal pancreas? A normal pancreas should have a homogeneous echo texture and be isoechoic with the surrounding fat. This is why it can be difficult to detect if the image resolution is inadequate. The size of pancreas is variable, but it should be less than 2 cm. If it's bigger than 2 cm, acute pancreatitis or any mass lesion should be considered. Additionally, the pancreatic duct should be less than 0.1 cm. In the picture here, it is the pancreas. It located along the greater curvature of the stomach. This is the duodenum. This picture shows the normal pancreas. In this picture is the left limb. It located in the stomach, and the spine should be around here. You will see the pancreas. And this is the body. It located around the pyloric region, and this is the right limb that located along with the descending duodenum. You will see the anechoic tubular structure here. This is the pancreatic duct. Portal vein. You see it is the left limb of pancreas, and there is an anechoic tubular structure in the parenchyma. Here, this is the pancreatic duct. Now I will talk about the urinary tract. Start with the kidney. The left kidney is usually well visualized with a ventrolateral approach. The right kidney is more difficult to detect, especially in dogs with deep chest. An intercostal approach will be performed. The kidney should be examined in both longitudinal and transverse plane, and its length should be measured in the longitudinal plane. The renal pelvis should be measured in the transverse plane. The shape, cortical echogenicity, and corticomedullary distinction should be recorded. What are the normal kidney? The normal kidney is a bean shape with a smooth margin. The cortical echogenicity is hypoechoic compared to the spleen and hypo to isoechoic compared to the liver. In cat, the accumulation of fat within the renal cortex may lead to increased echogenicity. The corticomedullary junction should be well defined. It is the corticomedullary junction. In cat, the renal length usually ranges from 3.0 cm to 4.5 cm, depending on breed, sex, and nutrient status. Older cats tend to have reduced renal size. In dogs, kidney size vary depending on breed, body conformation, and body weight. The kidney length to aortic diameter measurement is used to evaluate kidney size in dogs. The normal range of kidney length to aortic diameter is between 5.5 to 9.1. The renal pelvic diameter on the transverse plane should be less than 3 mm. This picture shows how to measure kidney length and aortic diameter. The kidney length should be measured at the elongated diameter in the longitudinal plane near to cranial pole to the caudal pole. The aortic diameter should be measured as the intraluminal diameter. The renal pelvis should be estimated in the transverse plane. The renal pelvic dimension should be less than 3 mm in dog and cat. This is the renal pelvis. How about the urinary bladder? The bladder is located in the caudoventral abdomen, and the urethra extends to the pelvic canal. When imaging the urinary bladder, it should be viewed in longitudinal and transverse plane, starting from the apex to the body and trigone. The wall thickness of urinary bladder can vary based on the urine volume. The urine content should be evaluated. What is a normal urinary bladder? The normal urinary bladder wall should be smooth. Wall layer actually is consist of 4 layers: hypoechoic mucosa, hyperechoic submucosa, hypoechoic muscularis, and hyperechoic serosa. However, these layers are difficult to define. The thickness of the bladder wall is detect without evidence of the urinary tract disease. Here is the urinary bladder. You must evaluate the apex, body, and the neck. This picture shows the different appearance of the urinary bladder wall depending on the urine volume in the same dog. In the left picture, you can see the bladder wall is thin due to marked urinary bladder tension. In contrast, the right picture shows the urinary bladder wall appear thicker but is smooth wall layer due to mild urinary bladder distension. Now I will talk about the adrenal glands. The adrenal glands are small plant structures located in the craniodorsal abdomen. Here is the left adrenal gland, here is the right adrenal gland, and craniomedial to the kidney. This is the left kidney, this is the right kidney. To identify the left adrenal gland, follow the aorta. This gland is located cranial to the renal artery. Here is the renal artery and caudal to the craniomesenteric artery here. The phenico-abdominal vein may be seen crossing the mid-body of the adrenal gland. You can use the color Doppler to detect it. The right adrenal gland is more difficult to detect compared to the left. However, it is located near the caudal vena cava. This is the caudal vena cava. First, find the right kidney and sweep the probe medially until the caudal vena cava is visible. The right adrenal gland can be detected in this area. The adrenal gland should be observed in the longitudinal plane to measure their maximal thickness, particularly in the caudal pole. Any nodules, mass, or vascular invasion should be reported. What are normal adrenal glands? In dogs, the adrenal gland has either a uniform hyperechoic echo texture or a hyperechoic medulla with a hypoechoic cortical ring. In cats, the normal adrenal gland has a more uniform and hypoechoic echo texture. The thickness of adrenal gland in dogs depends on body weight, as shown in the slide. Dog with body weight less than 10 kg, the thickness of adrenal gland should be less than 0.54 cm. Dog with body weight between 11 to 30 kg. The thickness of adrenal gland should be less than 0.68 cm, and dog with body weight more than 30 kg. The thickness of adrenal gland should be less than 0.8 cm. In contrast, the thickness of adrenal gland in cats ranges from 0.35 to 0.45. This video shows the normal left adrenal gland in dog. Here is the aorta. Follow the aorta to the renal artery. Here is the renal artery. It appears as a hook shape, and this is the left adrenal gland. This video shows the more normal right adrenal gland located near the caudal vena cava. Let me show you. This is the aorta. Approach on the right side abdomen, and this is the caudal vena cava here. You will see the adrenal gland around here. The next organ that you should to observe is the genital tract. We will start with the female genital tract. The cervix, uterine body, horn, and butt ovary are considered part of the standard abdominal ultrasound assessment in an intact dog or cat. The uterus is located dorsal to the urinary bladder and ventral to the descending colon and rectum. The ovaries are located in the region of the caudal renal pole. Here, this is the renal, this is the ovary. The ovary should be examined in true plane. Ovarian lesions should be measured at the maximum dimension. Ultrasound can be used for confirmation of pregnancy as early as 21 days post-breeding in dog and 10 to 25 days post-breeding in cat. Mammary change should be assessed if there are any problems. What is a normal female genital tract? Normal ovary are ovoid and bean-shaped. The ovarian stoma is hyperechoic or isoechoic compared to the adjacent renal cortex. This is the ovary is present as a homogeneous, no evidence of the cystic lesion. And for the normal uterus, it is a homogeneous hypoechoic structure with a smooth outline. The size of normal uterus is vary depending on the species, parental status, and disease. Here is the uterus. The uterus has a hypoechoic lumen, no evidence of any fluid, and smooth outline. Is located ventral to the colon. Here is colon. The ovary is the round shape. Is located quarter to the urinary bladder and ventral to the colon. To examine the prostate gland, measurement should be taken in both longitudinal and transverse plane at the greatest diameter of both planes. Any focal abnormality should be reported. For intact male dog, heat testes, epididymis, and associated vasculature should be investigated. If there is a concern of retained testes, ultrasound scanning should be performed from caudal aspect of the kidney around here to the inguinal ring and scrotum. What is a normal male genital tract? A normal prostate has a homogeneous hyperechoic echo texture with a smooth margin. It appears as a round or oval shape on the sagittal plane and a bilobe shape on a transverse plane. Prostatic size is significantly correlated with age and body weight in intact dog. Normally, testes has a oval shape and fine homogeneous echo texture. The border is a thin, smooth, and hyperechoic capsule here. On sagittal image, a central hyperechoic line is visible, representing the mediastinum testis. This picture shows the normal testes and prostate gland. You will see the oval shape. This is the prostate gland on sagittal plane, and this is the prostate gland on the transverse plane. This picture is the testes. The picture shows the oval shape of the prostate gland on sagittal image and present as the bilobe apparent on the transverse image. And this is the testis. You will see the mediastinum line here. Now we will talk about the lymph node. Abdominal lymph node should be routinely assessed during a full abdominal ultrasound because they are directly related to the drainage of abdominal organ and structure. Medial lymph node and jejunal lymph node should be observed in every examination. Other lymph nodes such as renal lymph node, hepatic, gastric, splenic, and pancreatic duodenal lymph node may not always seen. However, anatomic landmarks should be used to evaluate them. The short axis diameter of the lymph node should be measured. The normal lymph nodes are vary in shape depending on their location. For example, the jejunal lymph nodes are usually elongated in shape. The medial iliac lymph nodes are usually ellipsoid in shape. The normal lymph node has a smooth margin and hyperechoic capsule. The parenchyma is isotomy hypoechoic related to the surrounding fat. This picture shows a normal medial iliac lymph node appear as an ellipsoid shape with a smooth margin and homogeneous echo texture. This video shows the normal medial iliac lymph node is located at the aortic bifurcation. You will see this lymph node is the elongated shape, hyperechoic capsule, and homogeneous echo texture. This picture shows a normal jejunal lymph node located along the mesenteric vascular tree. It appears elongated in shape with homogeneous echo texture. The last is the great vessel. Great vessels such as the aorta, caudal vena cava, and portal vein, as well as diameter band, may serve as a landmark for identifying the lymph node. If clinically indicated, luminal content, diameter, wall abnormality, and congenital malformation, including blood flow, should be evaluated. To find the great vessel, first start with the left side, place the probe laterally, and then sweep the probe spine. You will see the aorta first because it's lie on the side of the abdomen, and sweep the probe to the medial. Portal vein is located ventrally to the caudal vena cava and aorta. In this picture, you will see the three vessels here. This is the portal vein, this is the caudal vena cava and aorta, and this hyperechoic line with the acoustic shadow, this is the spine. Note that the caudal vena cava in this picture is collapsed due to the compression of the ultrasound probe. Manual compression should be avoided when investigating the caudal vena cava. Let us show you the video of the investigated blood vessel. You will see this is the portal vein here, and this is the caudal vena cava here, and this is the aorta. And this is hyperechoic line with acoustic shadow is the spine. This is the end of my presentation. Thank you for your attention. Hello everyone, welcome to the My Vet Academy webinar. I am Somjin Sujikan from Mahanakon University of Technology, Thailand. As you know, today I will talk about the guide to standardization of abdomen.
Hi, Dr. Somjin. It's nice to meet you. Can you hear me?
Hear you more. Hello everyone.
Hi, lovely to
Can
meet
you hear
Dr.
me?
Somjin. Yes, I can. Although a bit laggy. Yes, I think
That's
your camera is about to be loaded. Okay, lovely to meet you, Dr. Somjin. Thank you so much for an insightful presentation. I think we certainly learned a few things from that. So right now we will be having the live Q&A session. So everybody who is watching, if you do have any questions for Dr. Somjin, please feel free to drop it in the chat box below. But right now, while we wait for the questions to load, let me ask you one question as the questions are loading. So how can we differentiate between a thickened wall caused by a non-distended urinary bladder and cystitis?
Okay, that's a good question. Firstly, patient preparation is important before examination. Patient urinate before the examination, the urinary bladder will not be distant and may be difficult to detect due to its displacement to the pelvic region. In addition, the bladder wall may appear thicker if non-distended. Therefore, it is advised to the pet owner not let their pet urinate before the examination for at least 30 minutes to 1 hour. Or maybe you will wait wait for about 1 hour before rechecking again. The next question is how to differentiate between a normal descended urinary bladder and cystitis. Descended urinary bladder, the wall may be slightly thicker than the reference range, but it shows a smooth wall layer. In contrast, cystitis irregular hypoechoic thickly bladder wall, usually located the cranial.
Right, thank you so much, Dr. Songchi. We do have some questions coming in. So, one of the questions from Stephen: what sedative do you routinely use in routine abdominal exam?
I not use the sedative because fully it affect the organ appearance. But if need or if require like the aggressive animal, maybe use like the opioid like butorphanol or morphine.
All right, thank you so much. And then for our next question, we have coming in from Siddhartha: how do we detect pyometra? I'm so sorry if I'm pronouncing that wrong, but yes, the person asked, how do we detect pyometra and how can we differentiate pyometra and content in GI?
That is good. For diagnosis, the pyometra because it sometimes look like the gastrointestinal, but you need to follow the uterus to the caudal region because in the caudal region of the abdomen you will see only 3 organs, right? Urinary bladder and large intestine and uterus. As between the urinary and large intestine, and you can follow the uterus to the ovary. If you can follow it, it indicates it is a uterus. It has the pyometra. And the wall, the appearance of wall of the uterus and gastrointestinal tract is different. The gastrointestinal tract may be shown like the 5 wall layer that I showed you in the previous presentation.
Lovely. All right, so for the next question we have coming in from Dr. R. So in severe splenomegaly, where will be the boundaries of spleen? Will it displace the other organs?
I guess please. I lost signal.
Oh, sorry. Okay, would you like me to repeat the question?
Yes.
Okay, so in severe splenomegaly, where will be the boundaries of spleen? Will it displace the other organs?
Oh, you mean in the splenomegaly, like?
Yes.
Oh, okay. In the splenomegaly, it has a mass effect. It's displaced like the stomach to the cranial. You will see like the intestine border. And the kidney, you will see the left kidney is displaced to the cranial too.
Okay, lovely. Okay, so it's really great. We have quite a lot of questions coming in. So the next question is coming in from Gautam, who asking, is there a referral range for the size of colic and jejunal lymph nodes in dogs?
Yes, there is a reference range of the jejunal lymph node and you mean the colon node, right?
Yes, for the size of colic.
Should less than for the jejunal should less than 7 millimeter. But for the colic node, it should be less than 5 millimeter. The thick, but if the lymph or like the reactive lymph node, the thickness may be thicker and it should more than 1 centimeter. If you have any problem about it.
Okay, lovely. For the next question, coming in from Gagan, how do we differentiate between mesenteric mass and hepatic neoplasia?
It's quite difficult if the mass is really large and attached the liver. But if it's like the hepatic neoplasia, you will see like the mass and the normal liver edema in the same place. But for confirm the hepatic neoplasia or the mesenteric mass, the CT should be more suitable for detecting.
Okay, that's great. For the next question, what can be the criteria for detecting mass in UB or blood clot?
Yeah, so it's a good question because we found a lot of cases in like this. For the blood clot, you can use for my technique, I use two techniques. The firstly, I reposition the patient to standing. If only blood clot, there will be change the position for follow the gravity. But in some cases, the blood is more attached to the urinary bladder wall and maybe not change when we change position of the patient. You can use like the color Doppler in your machine for detect the vascularization. If the blood clot is not the vascularization, but if the mass is have the vascularization in the parenchyma.
Okay, lovely. Thank you so much, Dr. Somchin. For the next question, coming in from Muhammad, how do we differentiate peritonitis?
Peritonitis, right?
Yes, correct.
This is from that I like in like the case that you found like the abdominal effusion. In the case of peritonitis, the appearance of the fluid is like the high liquid or the cell in the fluid, and in some case you will see like the abdominal lymph node enlargement. But if only just ascites, it's like the transudate. So the fluid is appear black or and more and equity.
Okay, understood. Okay, for the next question, coming in from Monica, what is the best approach to rule in and out free fluid in an emergency?
Okay, please. I'm not hearing.
Okay, what is the best approach to rule in and out free fluid in an emergency?
In an emergency, you must use like technique. The first technique is to scan in the full area of the abdomen, like the area of the urinary bladder and colon to see the fluid, or and then move to like the left kidney and spleen, and liver, hepatic and diaphragm, and like kidney and the liver is used to detect small. In some case, it's really small, have really small amount. You can put the dog to the lateral recumbency, and you like the left lateral, and you approach the probe to the left side because the fluid will fall with the gravity, and we will easily to see.
Great, thank you so much. Okay,